Cleft lip and/or palate, sometimes known as CLP, is one of the most common congenital craniofacial malformations and occurs because of a fusion error between the 4th and 9th weeks of embryonic life. CLP is a separation or opening in the lip, the hard or soft palate, which is the roof of the mouth, or a combination of these, and they may be unilateral or bilateral, complete or incomplete. There are 3 types of clefts. An overt cleft can easily be seen. A submucosal cleft is not quite as easily seen, while an occult cleft is a type of submucosal cleft that may only be diagnosed during an MRI. There are multiple risk factors that may lead to an infant being born with CLP, such as genetics, poor prenatal health care, smoking while pregnant, gestational diabetes, drug or alcohol use while pregnant, or even medication use while pregnant. Most of the infants born with cleft lip and/or palate experience difficulties in feeding and may exhibit symptoms of dysphagia or difficulty swallowing. Some of these infants may even be given a diagnosis of failure to thrive, meaning they are not gaining weight appropriately. A multidisciplinary team approach, including but not limited to a surgeon and speech-language pathologist, will find the best method to help these infants eat safely and effectively. Surgeries may be performed to completely correct the cleft lip and/or palate. Feeding appliances or specialized nipples may assist an infant in eating safely and effectively, and a speech-language pathologist may help the parent find the best fit for the family. Prosthetic feeding appliances are custom fabricated for each individual infant and help create a seal for the roof of the mouth, allowing the infant to suck more effectively and swallow more safely. Specialized nipples help avoid excessive air intake and allow liquid to flow only when sucked, which may help make feeding much more comfortable for an infant with CLP. If safe oral feeding practices are unable to be established for an infant with CLP, enteral feeding may help provide the infant proper nutrients until they are able to eat safely on their own or until they receive surgical intervention. Enteral feeding methods bypass the infant's mouth and provide nutrition directly to the infant's stomach or the small intestine. There are several types such as nasogastric, nasoduodenal, nasojejunal, percutaneous endoscopic gastrostomy, also known as a G-tube, or a jejunostomy. The NG and the G-tube are the most common types of enteral feeding methods. The quality of life and development of an infant with CLP are most important, and by using a custom feeding appliance, specialized nipple, enteral feeding methods, feeding therapy with a speech pathologist, or surgery, infants with CLP can learn to eat safely, and symptoms of dysphagia or discomfort during eating may be eliminated completely.